The Group for the Advancement of Psychiatry, GAP, welcomes you to the History of Psychiatry video series. Since the 1940s, GAP has been on the cutting edge of psychiatry in North America. In this video, we will explore the major trends in psychiatry through the words of practitioners who experienced them and through images that evoke these sweeping changes. Our subjects will be members of GAP. The 20th century witnessed an acceleration of theory, research, and practice in the field of psychiatry. Institutional care and isolation of both patients and doctors that dominated 19th century asylum medicine reached its peak. The scientific study of mental illness, lacking in late 19th century, found its voice in the work of Adolf Meyer and American psychoanalysts. General hospitals, psychopathic clinics, and community mental health centers flourished after the introduction of antipsychotic medications, and syphilis could be cured with penicillin. Theories of the mind abounded and captured the imaginations of a public eager for mental hygiene. And 2 world wars underscored both the frailty and resilience of human adaptation. In the 1950s, the only physicians willing to work at state-funded psychiatric institutions were international medical graduates. One of the GAP psychiatrists, Dr. Alan Gruenberg, lived on the grounds of a state psychiatric hospital. Dr. Gruenberg's Polish father was medically trained in Prague and later lived in Vienna.
My father came to the country, the U.S., in 1951. He went to work at the Eastern State Psychiatric Hospital in 1957 after working as a general physician in the local general hospitals. The early memories is of a hospital of 5,000 patients. The setting was on the banks of the Tennessee River coming out of Knoxville along a very elegant road called Lions View Drive until it ended at the state hospital grounds on the banks of the river.
Dr. Gruenberg remembers that the medical staff members were highly cultured and educated, coming from Brazil, Germany, France, Eastern Europe, Africa, and Asia. Similar to other state psychiatric physicians in the 1950s, Dr. Gruenberg's father had trained in surgery and general medicine, with no experience treating psychiatric disorders.
Between the ages of 6 and 12, I recall the outdoor basketball court, softball fields, miniature golf course, and it was very common. I would be playing with various residents of the hospital who had some form of prolonged or persistent mental illness. Our station van that took us to the public school was driven by a person with a persistent mental illness. He'd be there picking us up every morning and then be there at the end of school ready to pick us up from the public school.
In addition to treating general health conditions and delivering babies, Dr. Gruenberg's father frequently treated extrapyramidal tremors and rigidity, as well as hepatitis secondary to high doses of early psychiatric medications.
By end of high school and then through college and while I was in medical school, I had many occasions to walk the wards with my father. My most vivid memories are really the memories of the consequences of prolonged mental illness. People maintaining a posture for an hour, then moving, and then maintaining another posture for an hour without moving. There were patients who had persistent and acute hallucinosis who you could, in the more formal sense of the word, consider them to manifest profound withdrawal. The only conversation they had was with the internal auditory and visual experiences. Significant cases of chronic mutism where a person would not speak at all 3-4 days.
Dr. John Talbot served as president of the American Psychiatric Association and vice president of the American Board of Psychiatry and Neurology. Dr. Talbot is editor-in-chief of the Journal of Nervous and Mental Disease and editor emeritus of Psychiatric Services. He is a clinical professor of psychiatry at the University of Maryland and a GAP member of the Administration and Leadership Committee.
I grew up outside Boston, where my dad actually did some research at McLean Hospital, and I remember going with him and seeing people at McLean quite psychotic. But I remember particularly a woman who came alongside when I was in the car waiting for my dad, and she was walking in the snow and clearly hallucinating picking flowers in the middle of winter. And it really did make an impression. I said to him, you know, here I am, age 5, age 6, what was she doing? I mean, she seemed to be picking flowers, and it's middle of February, there are no flowers. To me, it seemed very, exotic would be the wrong word, it's just, but a very strange disease that would have that sort of impact on people. He was looking at schizophrenia, people suffering from schizophrenia who were being frozen at the time under the theory that some organism, perhaps a virus, perhaps something else, could actually be chilled so much that it would cease to affect the person. A very early idea of some of the things that some people now believe about viruses and schizophrenia. In college, I volunteered at a state hospital for a brief period of time, but really wasn't very involved. And it wasn't until medical school, when I became very interested in psychiatry, that I was lured to look more closely. And then in residency, I was in a residency program at Columbia that was very involved with quite sick people. And my first 2 months were at Rockland State Hospital, and I was fascinated by what I saw. And it's been a lifetime obsession since then, especially very, very sick people, on both a treatment and a policy level.
Dr. Leah Dickstein served as vice president of the American Psychiatric Association and president of the American Medical Women's Association. She co-founded the Association of Women Psychiatrists and served as national chair of the Association of American Medical Colleges Group on Student Affairs. Dr. Dickstein served as an Associate Dean for Faculty and Student Advocacy at the University of Louisville School of Medicine and was a GAP member of the Medical Education Committee.
I feel honored. I always wanted to be a psychiatrist. I didn't know why, but it was my secret from about age 8. I can't tell you why, because I don't know why. And of course I was a school teacher and I put my husband through medical school in Belgium and sold girdles and taught English at a Berlitz school and then taught 6th grade in Brooklyn, and then after 19 rejections, in 2 years, got into medical school. And I've just felt so honored to have this opportunity. And then I found out, an aunt told me to look up a Dr. Stephen Katz at a board exam. And of course, he turned out to look just like my father because we're related. Our grandparents were siblings. And then we have another cousin who's a psychiatrist in San Francisco. And then a rather famous Rabbi Twersky is a distant cousin. So it probably is one of my genes someplace.
A caring gene.
Yeah, I wasn't aware of.
In addition to somatic treatments such as electroconvulsive therapy, hydrotherapy, and new psychotropic medications, there were varieties of psychotherapies being conducted in clinics and hospitals. Freudian-influenced psychotherapies, as well as occupational, vocational, and art therapies, were often conducted by nurses, social workers, and other clinical staff. Family and group therapies became popular and were well studied, and added to hospital treatments. In addition, patients often worked in agriculture, cafeterias, and kiosks in the village-like environments of giant psychiatric hospital complexes. Dr. Gruenberg remembers the unpleasantness of being stigmatized at school for living at a psychiatric hospital, but also remembers being intrigued by observing patients with profound mental disorders coupled with viewing the benefits of treatments with electroconvulsive therapy, chlorpromazine, and later in the 1970s with the mood stabilizer lithium.
There was an initiative in the mid-60s to take part of the hospital grounds and convert it into a therapeutic community, which literally meant the building of 6 or 7 residence houses on the grounds for 16 to 18 patients, which would encircle a village with a church, a cafeteria, a recreational center. An initiative to try to anticipate what would ultimately happen, that many of these patients would not be cared for within a long-term state institution.
Dr. Gruenberg reports his childhood exposure to patients and their conditions led to his passion for psychiatry.
This era was remarkable in the way in which new medicines were introduced to the patients and really interrupted the more overt symptoms of the disease, which led to, over a 2-decade period, the real reduction in the total population of inpatients, and anticipated the closure of many state hospitals.